Diarrhea, 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 diarrhea. Diarrhea, 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 diarrhea. Oh, upset stomach, diarrhea, nausea, vomit, diarrhea. Woo, child. Did I just try to say I need some water? Diarrhea. That's what we're gonna talk about today. In this video, diarrhea, what can you expect in the emergency room? Big one. Common. What is the ER gonna do for your diarrhea, honey? And what do you need to do when you start to get it? You know, what kind of questions we gonna ask? What can you expect? Because you got diarrhea and you coming to the emergency room, so it gotta be bad.
911, what's your emergency?
Because when you call your doctor, they just gonna tell you to come to the ER anyway. What the ER gonna do, child? What we gonna do? Ooh, you gotta be feeling bad. Or you done travel somewhere. That's what we're gonna talk about. All right? So I am Dr. Teresa, ER, your good ER doctor, helping y'all be good patients, letting you know what you can expect. Can you wait? Do you not need to wait? Is this a right now? What they gonna do? What they not gonna do? You know, what I gotta do when I leave? All of that. Okay? Diarrhea. Think about, ask yourself. All right? You gotta ask. This is one of those ask yourself kind of symptoms. Okay? Ask yourself, have I been anywhere? Out the country. Okay? Have I been out the country? Have I been on recent antibiotics? Which I bet is a yes, because y'all love these antibiotics. Y'all get a sniffle. And you're like, I need a Z-Pack. I need an antibiotic. Like, you got the flu. I don't care if I got the flu. I want an antibiotic. You just got a cold. I don't care. I want an antibiotic. I don't care. I want an antibiotic. All right. So, have I traveled anywhere outside the country? Not to your neighbor next door, or you live in Louisiana, you went to Mississippi. No. Traveled outside the country. Some countries matter more than others, and have you been on recent antibiotics? Okay. Well water, things like that. That also is a concern. Are you having any blood in your stool, or is it no blood? Okay. Have you had a laxative? Because sometimes y'all be like doing that roller coaster. You know, I had constipation, so then I took a laxative and I got diarrhea, and then I tried to take an Imodium and I got constipation. You know, it's like a seesaw. You know, seesaw. Yeah. Okay. Yeah. You know, your personal history also matters. You know, do you have something like a Crohn's disease or inflammatory bowel, ulcerative colitis? Do you have anything like that? Any kind of the inflammatory bowel disorders that could be causing medications? You know, those are some of the things that you can think about beforehand that can help guide you. How long has it been happening, and how many times a day are you having it? Those are the questions that we're gonna ask. We're gonna ask you that because that matters. You know, have you been to certain countries? Have you been on antibiotics? Because sometimes we do give antibiotics for diarrhea. Sometimes we do not. Okay? And we take your answers for those questions during the history taking to help guide us as to your treatment. Most of the time, if you have not traveled outside the country, if you have not been on recent antibiotics, if you have not had things like well water or bloody diarrhea, then you can try certain things at over the counter first. Did you hear that? Did you hear that? It may help. It may help your diarrhea. Things like Imodium, Pepto-Bismol. Pepto-Bismol, if you take it, keep in mind, it will turn your stool black. Because you're going to end up having green stool, and the green going to turn black, and you're going to think you're dying. Then you're going to be like, I'm dying, I'm black. I'm like, I'm boo-booing black, doctor. I'm boo-booing black. No judgment zone. Listen. Okay, it happens. What, did you take Pepto-Bismol? Yeah, I've been taking. Oh, there. Oh, that's it, doctor. I ain't gonna die, Google. I thought I was gonna die. Oh, it was just a Pepto. Okay. Thank you, doctor. Thank you. Imodium. Certain yogurt, a lot of times when you're having a diarrhea, you are getting rid of your good bacteria. And so certain yogurts have like the lactobacillus, have the good bacteria to help restore your gut. Your normal gut flora is what we call it. Your gut flora. People say, what? Yeah, we call it your gut flora. It can help restore your normal gut flora. Probiotics, prebiotics, things like that. People like certain yogurts can maybe help store that with the Imodium and Pepto-Bismol. So those are some of the things that you may want to consider if you haven't traveled outside the country, had any well water, having any bloody diarrhea, had any recent antibiotics. What else I say? Inflammatory bowel, really abdominal pain. If you're having a lot of abdominal pain, a lot of cramping, if you're having fever, then certainly come to the emergency room. If you are lightheaded, dizzy, you've been having so many different diarrhea episodes that you feel like you really are dehydrated, because I'm gonna tell you, come to the ER just because of diarrhea. They may not do no fluid. They may not do no blood work and give you no fluid now. Okay. Let's keep it in. Let's keep our expectations. That's what I'm here for. Don't be expecting them to give you no liter fluid and put the IV in your arm just because you done had a couple days of diarrhea. No. We look at your vital signs. We can look to see certain things in that history taking. What you tell us matters. Tell the truth. What you tell us matters and helps guide us. And if this person needs fluid or if they don't, if you're not having any nausea, vomiting, if you're not really throwing up, also vomiting, if you're not vomiting, also, then that means you're able to keep things down. Okay, so you are keeping some fluid down because it's not coming up here. It's only coming up there. So we feel like sometimes if you're not tachycardic, your heart rate, your vital signs are good, your cap refill is good, then don't be thinking you're gonna get no IV fluid, okay? But certainly consider those things first, because I don't want you to not try anything if you don't have any blood in your diarrhea, travel outside the country, recent antibiotics, severe abdominal pain, fever, well water, those things like that, diarrhea for several weeks and multiple episodes per day. Then you can try those things and see if it will help your diarrhea. Okay. Whew. All right, we're gonna talk about the vomiting, because I know y'all like, oh Lord, what they gonna do for vomiting. There's patients that have vomiting, the gastroparesis, and then if you do marijuana, like some people do, marijuana, and they can't take that marijuana, they start coming in there with the vomiting because they've been having all the vomiting from the marijuana. And child, yeah, we gotta talk about that.
911, what's your emergency?